Welcome to the TROSAC 2024 Young Advocates Unite. This is a place where passionate young minds come together to tackle the pressing issue of substance abuse. Join the conversation on X, Facebook, and our podcast channel.
My name is Smart Teacher Nixon. I'm going to try to moderate this particular session. I will try. So please, if I make any mistakes, don't write them down. I beg you. So I'm the corporate manager for Cambridge Center of Excellence and also the executive director for Beroses International. At Beroses, our focus is on marital wellness and addiction recovery, as well as counseling, be it post-marital, premarital, corporate counseling, whichever type of counseling that you are looking for. And at Cambridge Center of Excellence, I do most of corporate trainings for people who are interested in project management, as well as every aspect of business that can help scale up, reduce wastage, and also bring profit and revenue to the company. When we heard about the TheReports Outreach, a mental health and substance abuse conference, I spoke to my boss about the conference. I thought that it was a timely initiative for us to raise up a conversation around mental health and as well look at substance abuse in the country. And our focus today will be on Ghana. So you can take a look at your time and tell the person sitting next to you good evening. Thank you. So the TROSAC, as you see here and also behind us, is the TheReports Outreach Substance Abuse Conference. The TheReports Outreach, I don't have much to say about it. So I'm going to call the founder of the TheReports Outreach, which is actually a non-governmental organization that was into a very brilliant initiative known as Food on the Streets. Food on the Street is where they go out to give food to underprivileged kids and satisfy their taste at least for a day, for them to experience what some of us experience almost every single day. However, they didn't want to end the good works over there. They decided to look at mental health and substance abuse, which has become a topical issue in our country today. And most of us believe that it has not been given the audience that it needs. It is our hope that after today's conference, almost every single person who is seated here will take the message outside. So, this is a very interesting question to ask somebody sitting next to you, but do you think you have mental problems? You should find out, because you should be sure of where you are sitting. So ask the person sitting there, are you okay? The mental problems is a bit too high. So ask the person, are you okay? Are you fine? Are you okay? Are you okay? I'm saying this because in our part of the world, it's very difficult for you to ask someone how they're doing and the person decides to be very honest with you. It's become a cliche, or for those of us in the religious setting, it's become a mantra to say, by His grace. I'm surviving by grace, even when they are lying. They have to quickly say by grace. But the people that you see seated in front of you are teaming young professionals who believe in this dream and also the initiative of speaking about mental health and also taking a look at the substance abuse. I'm going to introduce them in no particular order. We have joining us, we have Dr. Papa Kwesi Opare, is a dedicated medical doctor. He is currently practicing at the Greater Accra Regional Hospital at Rich. In addition to his medical career, he is also the project manager for Love Crew Ghana, health project coordinator at the TheReports Outreach, and a lead speaker for TROSAC. So if you've been listening to our Twitter space, you've heard Dr. Papa Kwesi Opare at the extreme left. Now let me come to some of the big, let me see, who is that, the other big person there? Okay. So joining us tonight as well, we have the Principal Regulatory Officer, a chemist by profession from the University of Cape Coast. The only university in Ghana. The rest can take their greetings online. She holds a master's degree in public health from the University of Ghana. She is also a public health expert in the regulatory field at the Food and Drugs Authority. She has over 15 years of experience in controlled substances regulation, which includes narcotics, psychotropics, and precursor chemicals under the 3 UN drug conventions. Ladies and gentlemen, Madam Juliana Amankwa-Marfo. Now let me look at the fine lady sitting next to her. She's mostly, okay, that's the, I think you should wave to them. Aha. She's a mixed breed. Cape Coast small, Legon small, so she's a mixed breed. We also have a lady who is mostly referred to as Lady Kwesi, nursing by profession, a philanthropist by heart, and a worshiper in the Lord. The only thing left for you to do is to be a market apostle. That's it. She holds a certificate in theology, certificate in customer care services, city and guilds in the UK. She is the founder and executive director of Kwesi Foundation, a non-profit organization. Ladies and gentlemen, our own Christiana Asiedua-Asiedu. Then I come to the visionary leader who is also dedicated and an advocate for children, youth, women, and community development. She is the founder of Eclectic Love. That is if I got it right. Eclectic Love. She's born and educated in the United States of America with a Bachelor of Science degree in psychology from Knoxville College. She has 90 hours certification in child care from Apple Corps of America, Baltimore, MD. MD is what? Maryland. Hey, and now can Maryland. Nice. In Maryland. A certificate in counseling children and also adolescents and child psychology from Udemy. Ladies and gentlemen, Patrice Robertson. And last but certainly not the least, I have my brother here. Say you should smile. Eh? You should smile. Smile more. Where is Humphrey? How many of us know our brother sitting next to me? How many of us? Do you know him? You know Prince Eli? No one knows Prince Eli. You people are not reading the news. You are not reading the news. You are not interested in the progress of Ghana. This man has brought a lot of development in Ghana, especially in the space where we are having this conversation. And for most of you who have not encountered him, I hope that tonight's conversation would open a window for you to, if we were in church, they would say tap into his wisdom and also his experience. Because I don't know if I should do it or Prince, you like to do it. Okay, so Prince was a trending individual on social media who was helped by our very own influencer. I hardly use that word to describe people, an influencer, but this particular gentleman, I would confess to you that he is an influencer on Facebook. He's called Nana T. Nana T, if you know Nana T and you follow him. He had an encounter with Nana T. Nana T reached out to Pastor Elvis Ajiman of the Alpha Hour initiative. And right after that encounter, Prince shared a story about how he went to school, met somebody who introduced him to substance, and after that, he was addicted to some substance. And to the glory of God, Prince recovered, going on every platform, speaking to people, having conversations with people for us to know that it is possible. If you step into the pit, you can still come out. It is possible. I think that's best. Let's put our hands together for Prince Eli. So first of all, I think I'll begin all the way from the top. Normally they say ladies first, but since they are saying about equality, I think the men too can go first. So Dr. Papa Kwesi would start with us. He will talk to us about, let me make sure I don't jump the area where you are supposed to speak. Yes. So our Papa Kwesi will be talking about treatment modality. So what I'll do is I'll come to Kwesi. Kwesi will be talking to us about mental health. I'll be doing that with Kwesi. So we'll take a look at Ghana's present mental health situation. What are some of the contributory factors and what we are also doing in our own way to mitigate the problem. So Kwesi, over to you. I realize that you have some notes. Please share your wisdom with us.
Good evening, everyone. We are so glad to have you here, and I'm also glad to be part of this. It's a movement, yes, and normally we have seminars, conferences like this, but I spoke with my team, our people, earlier on. I was like, I believe and I'm hoping and I'm looking forward that this, we know for TROSAC, or let's say TRO, it's not just one-off thing, that it's going to continue, and we have a lot of activities, down, okay? But then, as individuals, just as we are here, we are hoping that you don't leave here just as you came. It's not church. I'm not preaching, please. Yes, but then this issue is a global crisis that we normally don't talk about it so much. So it's a privilege to be here. And so whatever we are going to discuss here, okay, we are hoping that as you go out, you also use it effectively at wherever you find yourself. Thank you. And so when we talk about mental health, by the WHO, it says that it's a state of well-being, a state of well-being where individual realizes his or her abilities and can cope with the stresses. We are all in times where a lot of things are, hitting us. So the stresses that we encounter each and every day, we are able to cope with it, navigate through life with all the stresses that it throws at us. And then we are able to, be productive in wherever we find ourselves. I'm just breaking it down. Be productive wherever we find ourselves, be in the workplaces, in our families, communities. And so we also be beneficial to our community. But then, in a state or situation where your emotional well-being, that is where this whole thing is centered on, the mental health. So in a state where the emotional well-being, where an individual is supposed to be able to think positively, where their moods, their feelings, they be able to produce things positively, they are not able to do so, okay, then it becomes a challenge. I wouldn't say an illness. It becomes a challenge or a disorder. So this is what mental health is about in general terms. And there are a lot of factors that contribute to mental health disorders. Somebody will say that I'm not mentally derailed. We are not saying somebody is crazy, but one way or the other, we have all been there. Have you been stressed before? Please, have you been stressed before? Then it means you have been there too. Yes. Have you been? I recently heard about one doctor said, he was saying, if you are extremely shy, extremely happy, it's also a disorder. Because it needs to be moderate in whatever you do. As you say, too much of everything is bad. So in a situation where it becomes extreme, okay, the way you handle things, your emotions, your moods, it becomes your feelings, the negatives outweighs the positive, then it becomes a disorder. So we have all been there. So there's a little I can say about mental health. If there's any other question that Mrs. Matt you want to ask, and then we proceed.
So
thank you.
Adding up, please, let's put it together for her. So adding up to what was shared by Kwesi, there's something that I found out in my research when we were all looking into the mental health. A lot of times people argue that, it doesn't show on the person is not naked, the person is not on the street, the person is not taking off their shirt. So the perception in the African setting is that in order for us to know that someone is battling with mental health, the person must be on the street. The person must, be naked, or the person must have one part of their shirt torn, And so if the person is not showing any signs or symptoms in that direction, then we assume the person is okay. All right. And so that is where we have the problem. So I will just pick up the thoughts of Dr. Papa Kwesi on that. Dr. Papa Kwesi, why is it that a lot of people expect people to be, quote unquote, be mad on the street before they tell that, okay, this person is having a mental issue?
Okay, thank you so much. So that is the system that we find ourselves in. Actually, the definition or the word has changed from substance abuse to substance use just because of stigma. So then people just associate you to the fact that you abuse a drug. So they say, oh, you are a substance abuser. But because of this stigma, people feel or find it difficult to come to us, the health care providers. So that has been the system. So what we are doing now, we are advocating for, we are doing this awareness. So we are telling people to be able to freely come to us if they have any issues with their mental health. So these are ways where we are trying to change the system. But it is a system that has been there where society tries to classify or group people and put them aside so that they can't enter like the whole space. So that is the system there. But through these programs and through awareness and all these things, we try to bridge that gap. Yes.
When you say people can come to you, who are we referring to? Who can come to you?
So dealing with mental health involves everyone, right from the house, your parents, a little social group, your friends, your teachers, people you can trust, not necessarily a health worker, but people you can confidentially share, and then you think that they can have a positive impact. So to us as everyone, but especially people you trust that they can actually help you come out of some of these issues.
So talking about people, I want to focus on men because I'm a little biased than my fellow speakers. They have experienced that quite some time on our Twitter spaces. I'm a little biased towards men because I feel men are not being talked about much, especially when it comes to mental health. How many of us in this room knew that the month of June was Men's Mental Health Month? How many of us? So in a room of about 30 people, only 5 people knew that the month of June was Men's Mental Health Month. But 2 weeks from today, why are you laughing? Why
Breast cancer.
It's what?
Breast cancer.
It's breast cancer. Every company in Ghana will have pink all in front of their building. This shows to a large extent that there's not been a heightened conversation about mental health. Let's even take away the gender. Let's focus on the fact that we have had a month go past and not a lot of people even heard about any initiative, campaign, or whatsoever. But the moment we step into the month of October, every bank, every organization, everyone would go out talking about it. Now, the mental health that we discuss in Ghana is also culturally inflicted. So much so that when we were having the conversations prior to this particular conference, we were looking at some of the things that we have accepted as a natural thing or a societal thing that, as for men do not deserve to be pampered. Men don't deserve a soft life. Men are the ones that go out. Men are the ones that are supposed to suffer. Someone said in an interview, I saw it by Pulse GH. I was sad. Sometimes I see videos and I'm sad because I'm processing a lot of mental health issues in my mind. There was a Pulse GH video where the host was asking market women how much they receive from their husbands. And so the gentleman asked the woman, how much does your husband give you? If your husband gives you 500 and his salary is 1,000. The woman actually asked the host, what is he keeping the rest of the 500 for?
Yeah, I think I saw it.
Yes, like, so we may see these comments like sweeping comments, passing statement. They are not. Because there is a perception that men don't need help. Men suffer. Men are supposed to die. Statistics show that in the whole of US, the people that suffer depression a lot are men. 6 million every year. 6 million. 6 million. 90% of people that die at work are men. The people that die at work are men. 75% of rough sleepers, people don't know how to sleep well, are men. You understand me? That is how difficult the conversation is. And over 12,000 men in UK kill themselves every week because they can't provide. In the 12,000 weekly. This is what we are dealing with. We're dealing with a phenomenon that is not quite accepted very well in our part of the world. Because whenever you bring up a conversation about your mental health, you are not okay. You talk about it as a man. Everybody's like, Charlie, you know, you better go through them. We all will go through. That will be the first cut-off message from another person who is listening to you. You are not the only person suffering, Charlie. We are all in the system. So today, I'm glad Patrice is here. Patrice has had experience in the US, and she's brought some of her experience to Ghana as well. So, Patrice, you would tell us the communities that you've worked in, some of the factors you have encountered, you know. Marry it with the way we practice our culture in Ghana, and let's hear from your perspective. I think that would help.
Hey, Jesus. Okay, so in the U.S., how we process mental health is if you have an issue, you can discuss it with someone, and then you're able to go get some type of help, whether it be counseling, medication, or whatever it is. Now, one thing, though, is how all of us look the same. You see the skin color. We all look the same. So in the U.S., in some communities, those of us that look like ourselves is something that is not the same as here. It's not something that is well spoken about. So if you come from a family to whereas they're able to talk about it, then you're able to get help. Now, if you're not able to talk about it, then you can end up on drugs. And so in a lot of communities, especially those where, let's say, the income is lower, you see a lot of them, especially kids, they're using drugs, they're gambling, they're turning to sex, all of these things because they don't have the right access to discuss their mental health. Now, when you come here, they almost go hand in hand because here in Ghana, we as a community, it's a stigma. It's not something that anybody wants to talk about. If something is wrong with you, you keep it to yourself. If you tell your friend about it, then they're looking at you like, hey, like, are you sure you're okay? Like, what is wrong with you? They don't even know the right places to even direct you to so that you can get some type of help, that you can talk to somebody about it. So the mental health aspect, like, depending on where you're coming from, they're the same, unless you have education, unless you come from somewhere to whereas you're able to share, and there's some openness. But if not, then it's a shh, don't tell anybody. No, nothing is wrong with me. And you keep it, and you grow up with that, and then it becomes a cycle to whereas now you pass it on to your kids. And now your kids, shh, nobody says anything. Until finally, you hear on the news, such and such and such and such has tried to kill themselves. Such and such is dead. And now you're tagged. Your family is tagged. And you don't know what else to do. So for my perspective on it, I see both sides. I've seen the sides where in my family, we talk about it. If something is wrong with us, then we share. And it's something that equally, for me here in Ghana, I teach our kids the same thing. Any of the kids that we work with, even one of our programs, one of the actual sessions is focused solely on mental health. So therefore, they know different techniques to use. They know different ways that they're able to talk to people. They know they're able to identify if there's something that is happening to them mentally. And then they're able to also know, okay, I have this person that I'm able to talk to. I have this person that I can trust. They even have to list these people in the class. So they have to list the people that they trust, that they know that if I go to this person and I share with them, then this and this could be the feedback. But they also know that if they share, then whenever they share, it's confidential, but we have to make sure that you get some help. So it's not just, okay, you tell us, and then some days later, then you go and you do something to hurt yourself, or you go and use a drug, to where it's created a ripple effect. They know that there's some type of help that will come to them.
All right, let me move to Juliana. I think that the conversation has always come back to your table because you are in the outfit that regulates drug use. So in order for us to know that we are all learning, Papa said we have moved from substance abuse to what? Substance use. Okay. So we have made that progress. Okay. So Juliana, now we have a dire problem in our face in Ghana today. We have one of our dearly beloved Funny Face going through an episode. Okay. He's going through an episode and it should be like of a national concern to everybody. I'm coming to you because you're in the drugs authority area and you're part of the regulatory body. When we see people in videos who are using substance, from your outfit, at what point do we need to move in? What do we look at first before we say, okay, now we need to arrest somebody? Or someone will say, no, smart, they need to have a certain amount before you can arrest them. Someone will say, no, the little they have, you can still arrest them. Another person says, oh, it must be at least 20 pounds before you arrest them. Help us, because that is your area. Help us. When do we intervene?
Thank you, and good evening to you all. When we come to Food and Drugs Authority, with our jurisdiction, we are responsible in regulating food and drugs for medical purposes. And so for the drugs, we include cosmetic, household chemicals, and veterinary drugs. When it comes to the hard drugs, from where the scenario you just explained with Funny Face, Narcotics Control Commission will be responsible for that. Here in the case that any substance or drug that is being used in the sense that, for instance, let's take coke, which is usually known as cocaine. The short term is coke. And so with those, we believe that they are basically meant to be used illicitly. We don't have coke in our medical sciences, which will help you in any condition of any sort. So all those ones are under the regulation of Narcotic Control Commission. So when it comes to Food and Drugs Authority, I would say if he was to be using tramadol is a POM drug, a prescription-only medicine, which we regulate to ensure that the strength that comes to the market, the process by which it is made, how it gets to our consumers or gets to our patients are in efficacious states, they are of well quality, and so when someone takes it, tramadol is an opioid, synthetic opioid, and so if you use it, we usually give to patients who have moderate to severe pains. And so then when we give you those drugs, we believe that Food and Drugs has already seen on the market that 37.5 milligram, 50 milligram, and 100 milligram are the only prescribed dosage that has to be used by patients. So if you see any other one that is above these strengths I mentioned, then it presupposes that it's a counterfeit drug. It's a counterfeit drug. And so here we have the authority, or the government mandates us to go and seize those products. So with Boniface, I might say, I can't really tell which substance he's on, because for tramadol, as an example I gave, it's a prescription-only medicine. And so if he's to be his physician put him on tramadol, I presume that he should be on the prescribed dosage. So then if he goes beyond what he's supposed to take, then we term as substance use.